Hello, my name is Jan Rice and I'd like to introduce you to wound management, the basics and the must-know in aged care. So I have a declaration that I will receive an honorarium for the time that I've put into this presentation, but I have no other monetary ties to the company and I've been not coerced in any way to say things that I don't believe. I will be speaking from a clinic perspective following many years of using the products that I'm going to speak about. And I was very keen to do this because I have used the product way back in 1980. It was in Australia then, and then it disappeared for a while. It's made in Sweden, and it's been back in Australia for about 10 years. But sadly, a lot of people still don't know about it and its applications. So wound management's not simple. We do try to make it simple, I know that, and we attempt to make it simple by using colour descriptors, by simplifying the product selection. Some of us are lucky enough to have protocols, which of course if you need protocols we can help you develop, or you can develop them in-house. And of course always we're setting our goals in which we can then follow through and hopefully simplify the process. You will know that there are colour descriptors used all the time in our language, but the reality is we should be speaking about tissue types. The problem though is many people actually don't know the correct colour to use for the tissue. So pink, when you use that colour, you're really talking about a wound that is healed. And you have pink healed epithelium. Red is granulation tissue, but you're not to mistake that with hypergranulation, that jelly-like tissue. Yellow is slough and it's tenacious, moist, dead white cells and other tissue. Black is dry, hard, tar-like tissue, eschar. And green is slimy, moist, infected tissue, and white is macerated tissue or dead keratin tissue. So whilst the tissue is important, we do need to try to understand just what the body is trying to do in order to heal the wound and why it started. So it's really important to get a diagnosis and understand how this wound started so it doesn't happen again, but also because you might need to call in some other health professionals depending on the diagnosis. It does require all health professionals, therefore, to obtain a history of the wound and other medical, surgical issues that may have relevance. Recognising what stage the wound is in within the healing trajectory is also important. So the phases of wound healing, you may remember or recall, we talked about the inflammatory phase or destructive phase, the proliferative phase, the epithelialization and the maturation. And of course, all the way along here, the tissue is changing as it moves through those phases. So how long is it acceptable for each of these phases to last? Well, the inflammatory destructive phase lasts approximately 72 to 96 hours. The proliferative phase is up to 3 weeks, but will start within a few days of injury. Epithelialization should be complete within a month, but you should start to see skin growing at the wound edges in about 10 days from injury. 7 to 10 days from injury. And maturation is when everything all reorganises itself. And so in actual fact, the time given for complete healing of a wound and complete maturation of the wound is 12 to 18 months. So product selection is difficult for some and for others it's very easy. Some of you may have many products to make your selection from, and that then makes it complicated because you've got a lot of choice. Some of you have very basic, often traditional products, and so choice is not a problem. The answer to the problem, though, is to have the products to meet the various phases of healing and what the body is trying to do. So Sorbact is a physical, not chemical product. As I said to you, it's been around for a long time. There are many papers out on it, many case studies for you to request, to read about, to boost your confidence in trialling this product, using it and learning how to use it to your advantage. It is a binding dressing. So on the packet you'll see it says it's an antimicrobial binding dressing. and it will bind bacteria and fungi to the actual dressing. It's not an antibiotic. It's not an antiseptic. It is an antimicrobial wound treatment, though. So how does it bind the surfaces? It's through this hydrophobic interaction. When two hydrophobic particles come in direct contact, the bind together with the binding force of the surrounding water and molecules equals a hydrophobic interaction. So the advertising for the product actually shows you a green mesh, and you can see all the bacteria are attached from under a microscope. It's a very good visual understanding of how this dressing works. It comes in many forms. For most of you, you will know that I will recommend the Sorbact compress, which can be opened up and cut to just over the size of the wound. It doesn't matter if it overlaps the wound, and then you add all your other things on top of it. But you'll see here there's a Sorbact gel dressing, the compresses I've mentioned, there's the surgical dressing, the ribbon gauze, which I'll speak about after, the round gauze swabs, the foam dressing, the gentle foam border, an absorbent dressing, a super absorbent dressing, and then the negative pressure wound therapy filler dressing. So let's have a look at the tissues and what are their aims. So if we talk about pink tissue, that's that new epithelium, our aim is to protect it. So yes, simple non-adherent products like Melalin could be used. Mesh dressings could be used, such as Mepitel. Silicone foams could be used, such as biotane silicone. Or if you're really happy, and you could just use a good quality moisturiser, such as QV Intensive with ceramides, which is a new product and I encourage you to look at. The thing about the Sorbact range is that if you had Sorbact range in your trolleys, then the Sorbact gel will protect, but it will also manage any lurking bacteria without adhering to the tissue. For low exuding wounds, low exuding granulation tissue rather, you can use a foam, a hydrocolloid, or a small amount of hydrogel on a simple non-adherent pad. But once again, the Sorbact gel or the Sorbact foam would be appropriate here to protect low exuding granulating tissue. To remove slough, you have a range of products, and there are many that we try. You've all got iodosorb, I know. You've got Flamanel, Mease salt. Some family members or the resident themselves request medicated honey. There are surfactant gels and there are silver-containing dressings. Here, your Sorbact gel will again aid in the removal of slough. To manage locally infected wounds, it's pretty much the same regime that you're looking at. The one that I would like to highlight here for you, though, is your fungal issues. When you have intertrigo, so the rash under the breasts or in the groins or between the toes, I would encourage you to have a look at the Sorbact gauze. There are great papers on it. I've had great results with it. It's a cost-effective product between two skin surfaces, like under the breasts or in the groins. The Wound Infection Continuum from the Wound Infection Institute talks about contaminated, colonised wounds, locally infected wounds, spreading infection and systemic infection. And you see the arrow there going down the lower end, contamination and colonisation. They're saying you don't need any antimicrobials. Then you can step in with your topical antimicrobials at the local infection point and then continue up using antibiotics and topical antimicrobials if the condition has got worse. That's what the Wound Infection Institute is saying, but there is no harm when looking at this product, which is so safe to use, to not think about using it right at the very beginning of a wound. So when you have a wound, you're down at your clean, contaminated, colonised end, so it's a new trauma wound. There is no harm in using the Sorbact down there. It is a relatively passive but gentle, active product, if I can use passive and active in the same sentence. So you'll see in their company literature, they encourage you to use it right through the wound infection continuum. To manage black eschar, it's often a sign that there is a blood supply problem, either due to an arterial blockage or narrowing, or due to pressure that occluded the blood supply, and so the tissue is now dyed. In most cases, if you have dry black, the rule is to keep it dry. So you're either going to paint it with povidone iodine or apply a povidone iodine gauze pad. The basics that you must know about wound products is how to use them, when to use them, are there any contraindications, when to change, what secondary dressings are required, and of course you need to know that it's working for you. So you've set your goal and now you're looking at it to see if you're beginning to achieve that goal. So how to use the Sorbact range? It's simple. The product is a very simple product to use. When to use? Well, from clean contaminated right through is appropriate. Are there any contraindications? Extremely few. There's not many at all. When to change? We generally say start with daily or second daily dressings, move to third daily, and then most of us will be on the twice weekly change. The secondary dressings, if you're using the Sorbact compress, then yes, you've got to add your layers thereafter. However, if you've got the Sorbact range in your facility or have the ability to purchase the Sorbact range, then they come all pre-packed. How to know if it's working? Look, if you're using it to protect the wound, you'll see the epithelium growing nicely. If you're using it to protect the granulation tissue, you'll see it does no harm when you remove it, and you'll see epithelium growing at the edges. If it's used to remove some slough, the slough has to be a light, fibrin, thin layer of slough. If it's thick, heavy, tenacious stuff, then clearly surgical debridement or conservative sharp surgical debridement would be necessary, or we might have to look at other products. And so you're able to assess, is this product doing what you want it to do? Don't forget the other important aspects of wound management, though. The principles of wound care state that the etiology or the diagnosis and addressing this is the most important consideration, and then looking at all the factors influencing healing like nutrition, pressure offloading, etc. But then you start to think about your product. What are you going to use? I hope you find that this product may in fact help you to heal and simplify the process of product selection, and also allow you to concentrate on the aforementioned issues. Like, because you're simplifying a product range in your facility, you're able to concentrate on nutrition and other things like that. It comes in many, many forms, as I've said, and there are great case studies, and we believe that Sorbact would meet more than 60% of your wound needs in your facility. I'm always trying to find cost-effective solutions for you, and I do state when I recommend the compress form, I say it's cheap, but people ring me afterwards and say it's not cheap. It comes in a box of 40 pieces, so I know that when you multiply one piece by 40, it does appear expensive. But what I would say to you then is buy a box and share it through the facility from first floor, second floor, third floor, or with each section. Then you've got it in your facility, and it is cost effective to use, all right? And the other thing is that what you might find is you're able to reduce some of the other things that you have in your trolley and thereby save money. Right from the start, you can use Sorbact from the beginning of injury to healing. It's a preventative, safe, proven method of assisting in wound management and wound healing. And for more information, I would encourage you to contact Bayport Medical. They have the case studies, they have the clinical data, they're able to supply you with some samples also to get you started and get your feedback on the product. I hope you've enjoyed this, and thank you again for joining this presentation.